And thanks everyone for your patience with that. So actually, Sharon, you could, yep, perfect. Thank you so much for handling all the slides. So I think what we were mentioning was, sexual and gender minority is the focus of what the reports were. And I just wanted to highlight the concept of minority stress, which is the idea, thank you, Mariel, I'm so glad that you folks can hear me, that minority stress is a theme that we see throughout this. And I think this has bearing on the data that Wallace just presented on all the other issues that come with houselessness when we talk about our sexual and gender minority people in Hawaii. So the idea of minority stress is it's not by virtue of your status as a sexual gender minority that is the risk factor in a sense, but it's the things you experience that contribute to that. So as a queer cisgender man, that doesn't put me at risk just by being a queer cisgender man, but it's really the things I might experience that push me towards certain risks, right? So just wanted to kind of highlight that. So next slide, please. And what we'll see, and I put it in the chat for those of you who are able to see it also, is a link to these reports. And I think probably, the data comes from Youth Risk Behavior Survey, which is done in our local public schools, high schools and middle schools, already every odd year. So we're really just pulling the data to see what was happening for our sexual and gender minority youth locally. Next slide, please. And I'm going to just go over a few of the select slides. And again, you folks can look at this more thoroughly afterwards, or you can also just click on the link to download the reports yourself. And I'm always happy to talk over this with you. This is the definitions we use. So if you could go to the next slide, please. And what we'll start to see already is that these are communities that do need services, and I think housing is a big part of that as well. Next slide, please. We'll start to see here, you can see here LGBTQ, so Q in this sense is questioning. And so in Hawaii, and this is just among public high school students who were surveyed and who happened to be at school that day for the survey. So at least 4,700 LGBTQ youth at public schools in Hawaii. So that's if you add, if you filled up the Waikiki shell twice, right? So we really can't ignore this community of students, which is likely more. Next slide, please. And as I mentioned earlier, the 2018 report focused on trans youth. So we have trans youth data that we can show here as well. And so you could see here, for trans youth, it's about 1,200 students. So that's, I think, if you combine Lanai High School and Molokai High School. Again, we cannot ignore this community of students. And also, you can already see here, and I put this in the chat earlier, that about half of trans youth are not housed with their guardian or parent. And anecdotally, this is because they were kicked out or they don't feel safe at home. So many issues that come up for our trans youth around housing. And you can see compared to their cisgender counterparts who are stably housed at about 94%. But I think the next slide, if you could go one more, will show the comparison between LGB youth and heterosexual students and and trans youth and cisgender. So you could see here, trans youth are 8 times more likely than cisgender youth to be unstably housed, and LGB youth are 2 times more likely than heterosexual youth to be unstably housed. So we can already start to see the disparities that will play out and some of the things that Wallace was already discussing. In the interest of time, I'm gonna just skip ahead. So I'm actually, I want to turn it over and give space for Bianka to talk about what's happening in Kauai. Again, these slides are available for you folks, and you can go into a deeper dive with the data. But basically, the theme that we'll see, if I were to go over each one, is that there's more risks for our LGB and our trans youth around coping and addressing the issues that come with discrimination and sometimes outright assault. So those things around violence that Wallace mentioned, things around substance use for coping, I think that all plays out especially for our houseless people who are also sex and gender minorities. So thanks for your time. Apologies again for the technical difficulties, and I will be here to answer questions both during the session and afterwards, but I want to turn it over to my lovely friend Bianca to talk about what's happening on Kauai. So over to you, Bianca.
Aloha everyone, my name is Bianka Tasaka. I am from the island of Kauai. I do work for Malama Pono Health Services as their lead medical assistant slash prevention supervisor. And I am going to share a little bit on the services that we provide on the neighbor island of Kauai with our homeless outreach and houseless services. Next slide, please. So here at Malama Pono in Kauai, we do have a great mobile outreach service a van that gives us the opportunity to utilize these services for people that are experiencing houselessness or homelessness or unshelteredness in the communities that we seek to provide those testings, such as areas that the county provide for those individuals that are experiencing homelessness or unshelteredness, where we can go to provide HIV testing, STD testing, syringe exchange, condom distribution, smoking cessation, lozenges, patches, and gums for free, women's services, birth control pills on certain days that our nurse practitioner is available to provide those services. If not, we would refer them back to our clinic in the office in Lihue. Pregnancy testing for some women that need that extra reassurance on pregnancy testing, as well as trans services. We do have some trans that are experiencing houselessness and sheltered and homelessness here on Kauai, which I'm gladly to be out there and provide those services for my trans community. And if anyone is needing any other further services, such as our outreach mobile van can't capacitate, we would have them come into our offices to utilize those services in-house. Next slide. So in-house, this is what some of our services that we also provide with our mobile services, such as clinic support and education services, trans wellness. As a transgender myself, I'm really glad and appreciated that my service organization offers these trans wellness services for our community, as well as different service organizations on different islands that do these types of great work and support for our community as well. Women wellness, pap smears, breast exams, BCP birth control pills, IUD and Nexplanon services, hepatitis B and C testing, as well as Hep B vaccinations, STI testing and treatment. So if anyone comes in with a possible risk or exposure to an STD, we can definitely prophylactic treat them if they are experiencing STI symptoms presently. Also, we do provide PrEP services, pre-exposure prophylaxis services that individuals might feel the need to want to access, as well as smoking cessation in-house, where again, like I said, in our mobile unit, we provide NRT services, nicotine replacement therapy, such as patches, lozenges, and gums. Also, we do food pantry services for our clients that are qualified with HIV and AIDS. We also do provide Hawaii HIV Drugs Assistance Program for those individuals that are coming in to utilize our services to help implement them in rehabilitation if anyone wants to or are experiencing those effects or symptoms or needing that extra service or guidance. As well as housing assistance for qualified HIV and AIDS clients and those that are experiencing or have been affected with COVID-19. So So those people that are experiencing homelessness at this time or have trouble paying for their rent, we do try to help them in guiding with those services. Community education, we do go out to different areas in our community to offer outreach services. And it's also one thing great on our neighbor islands to connect and collaborate with other service providers to have a great navigation process for individuals and clients that need more in-depth services that they might need or are experiencing. But with that said, I definitely put my information in the chat. And if you guys have any questions, please get a hold of me, contact me. And again, I'm on the island of Kauai. Thank you for your time. Aloha. Oops. And with that said, I'd like to turn it over to Kunane.
Hi, good morning, everyone. I'm hoping you folks can hear me and see my lovely face. Is it working out over there? Okay. So, thank you to my fellow panelists who have come and shared a little bit about LGBT, the community and some of the impacts. And so, we'd like to give a lot of data. We like to share about our community. What I'm going to talk about this morning is about providing services, and then we're going to talk about the barriers, but I believe in solutions. So yes, there's always going to be sometimes a barrier for whoever's standing in front of us, but I definitely want to make sure that we have some solutions. So I'm the LGBT Program and Capacity Building Manager over at Hawaii Health and Harm Reduction Services. One of our newest programs that we just started on October 1st through funding, through Partners in Care and the YHDP, so is our Guide on the Side program, which is directly serving and supporting LGBT houseless youth. So we're really excited about that, to be able to be in the community and provide these services to the specific community we're talking about today. So I think for us, it's really important to understand what are some of our issues that our community sees. And I'll say my community because I'm a member of this community also, right? As a gay man, I have experienced and overcome some of these same situations. So my community, right? So stigma and shame. There's a lot of stigma and shame that comes around with when you're LGBT, and it can come from in and outside of our communities, right? A lot of times from the outside of the community, people are looking at us like we're naughty, we're bad, whatever it may be, right? We're different. And because someone's different, people get looked at in a different way. But then also within our community, there can be a lot of stigma, right? Sometimes the gay boys have issues with the transgender community. There could be stigma based on age. There could be stigma based on where you live, or, other factors, right? Being houseless can be a big stigma from within, that kind of thing. And so we still see a lot of stigma and shame within our community, or experience that. Not at my dining room table is, I coined this term a while ago because growing up, I was taken in and loved by my best friend, my girlfriend, and I would stay at her house 5 nights a week, and her family loved me like I was their own child, right? And then when her younger brother came out of the closet and shared that he was gay, they just owned him, and I couldn't figure out what this all meant and what was factoring in. And what I discovered is that it's okay for someone to have that little gay boyfriend, right? Or transgender friend or something like that, but don't let it be my child, right? It's not at my dining room table. And there was a question in there about, where do our trans youth stay when they're not with their parents? And my friend he moved off island because it wasn't safe to be home. Culture impacts our community, right? Some cultures here, it's just taboo to be, it's unacceptable to be LGBT, right? And then some cultures will support us also. So that's important to know. So culture will impact some of us. Right now, lack of knowledge for our community, right? We don't know that all these wonderful services exist. We don't know that Bianka is on Kauai waiting to open her arms and give us support. So we don't know where to go, right? We don't understand what our risk is when it comes to HIV, when it comes to some of these things that are out there. Substance use is rampant in our LGBT community. Rates of substance use within our community are much higher than with our cis or heterosexual counterparts. Same with suicide, and a lot of this will stem from the lack of family support system. And then again, some more being judged, right? As I'm coming in looking for services and you're looking at me saying, well, you know, if you didn't act this way or you didn't do these things, you know, maybe you wouldn't be in this situation, right? So we're being judged for who we are, right? If you weren't all out all night trying to make money or engaging in sex work, you know, right? So we're being judged. We're not being understood. I can't get a job, employment. So my solution is sex work. Or I deserve what I'm coming in for, right? I deserve what I got because of who I am and what I've done. This is a big one, not being addressed as we present, right? Somebody comes in and we using the wrong pronouns. We're misgendering a person because we think their birth certificate says male, but then we have this beautiful, you know, we have a female standing in front of us and we don't acknowledge and use the appropriate pronouns. We don't use the appropriate name, right? Their name, their pronouns. We need to ask, right? The myths about our community that every transgender girl is going to be a sex worker or a showgirl, that kind of thing. Every young gay boy is looking for a sugar daddy or is using substances and things like that. The myths about our community, right? And because of our circumstances, we're uninsured, limited access, we have no money, right? Guilt by association. I see that a lot here. I work at previous Life Foundation. People didn't want to come for an HIV test because they were going to be guilt by association. Either I'm living with HIV and or I am doing something I'm not supposed to, right? And then our service providers have a lack of training on LGBT communities and are culturally inappropriate when we come in and don't know how to address us. Okay. All right, so here, right, that's all the issues. Here's the solutions, everybody, we want everybody to be amazing when one of our community comes in, right? Provide a safe space when someone comes in, right? And I bet a lot of people already know some of this or are doing this, right? Address each person by their chosen name and gender, right? Using the correct pronouns. And if you're not sure, you just ask or introduce yourself. My name's Kunane. I go by he, him, his pronouns. What's your name and what pronouns do you use, right? And so that's when we can ask that question. And then you document that on the piece of paper so that if even in your system, if it says George and you have Gina standing in front of you, everybody should call her Gina. You can worry about the data entry system and using George when no one's around, when Gina's left, right? People first language, right? I'm someone who engages in sex work. I'm someone who uses substances. I'm not a drug user. I'm not a sex worker, but I'm someone who's engaged in something, right? So the people first, we celebrate who's standing in front of us. Everything else is extra. Standardize your questions. You ask everyone the same questions. Don't just assume, right? You see Thaddeus coming in, you ask Thaddeus, well, how many female partners have you been with in the last 6 months? And Thaddeus is going to say, oh, no, girl, none. We've missed the opportunity to get all the information when we're doing something like a risk assessment, right? So how many partners have you had in the last 6 months? And we're male, female, and transgender. And you put them all in there. And if you tell somebody, I ask everyone all these questions, then there's no stigma attached to the question. I don't feel like you're asking me because you think this is what's up me. Or I come in and you ask me how many male partners, and I'm saying, well, what if I'm straight, right? You missed an opportunity. Focus on the client's needs and not their gender, right? Or their sexual orientation, unless it's pertinent to what we're doing. If you have an LGBTQ staff member, that's even better because I look and I think, oh, this person's going to be my friend. I can talk to this person. We connect easier. Next slide. Respect confidentiality. This is big now. It's a small community. If someone comes in and you break their confidentiality or they don't trust you, they're going to tell people, don't go there. She's going to voila out your tea, right? Don't go see Miss Bianca. She's going to tell the girl down the street what you were there for, that kind of thing. We don't want that. Small community, we talk. We will let them know where it's a good place and a safe space and not. If you can, go with them to appointments. Offer diversity in your referrals. This is a big deal now. If you're going to send someone to go see Bianca, you want to make sure that Bianca's going to treat them as good as you are. Right? That's the thing, right? Or Thaddeus is going to be as welcoming, and Wallace, and that kind of thing. Be culturally sensitive and appropriate. Listen to what they're saying. Manage your own discomfort. That's a big thing, you know. Because if I tell you that I was with 12 men last night and your eyes open up big, all of a sudden, or my partner might be 30 years older than me or something like that, right? Especially when we're working with you. Or I'm engaging in sex work, so I have somewhere to sleep. We have to manage our discomfort and hear what they're saying. And we can worry about ourselves when they leave, right? Be client-centered. And then check your privilege. This is really important, right? Because what might not be an issue or something that we have experienced doesn't mean nobody else has experienced that, or they should, maybe they're not, and they shouldn't have an issue with what's going on with them. It's really important. So here around asking the correct questions, right? If you want to know if you're collecting data around someone who might be is transgender data, sex at birth, two-part question, right? What is your sex at birth? And what is your current gender? And if they're different, then the person in front of you is transgender, and that's how you can collect transgender data. If you're asking around risk questions, around sexual risk or things like that, I like to ask, what do you enjoy, right? What do you enjoy? So asking the correct questions. And the other thing is, do you really need to know? Are you asking a question because it's going to support the service you're providing that person? Or are you asking the question because you're just nosy? Right? If you really want to know, don't. Yeah. So within agencies or programs, it's good to have policies around name, pronouns, restrooms. If you have a housing program, living quarters, where does this individual live, right? UAs, be respectful, and you have a conversation around who's going to be the person who's collecting the UA, and confidentiality and privacy is very, very important. And that's it for me. It's around services and just being supportive of our LGBT community. So we still have time for questions at this point. Oh, there we are.
So I'll just mention, and I also wanted to thank my co-panelists again for their great presentations, and apologies again for the tech difficulties. A couple questions did come up in the chat, which I tried to answer, but I think all of you folks might have more insight. So one question was, do we know where trans youth are staying when not with their parents? And so I just shared in the chat just a few things, and Kunane, if you want to add to that, that what we've heard is that many of them are staying with friends or extended family, but some of them also are living on the street. So Kunane, did you want to add to that?
I did want to, we do have that house. There's houses here. So a lot of times we'll see, because we're seeing our transgender youth, younger and younger, being put out onto the street, right, out of their homes. So then sometimes they're taken into these houses, is what we call them. And so so this individual will end up with like a Hanai family, someone who is supportive of their lifestyle, supportive of who they are, and it can empower them on this journey. So it's almost like they have a second mom, or that kind of situation. And so that's another good thing to know when somebody says, well, I'm going to come in with my mom, and then the person who comes in might only be 3-4 years older than them. But this is the person who's providing that support for that individual at that time. They're providing that safe space, that home, that guidance, that everything that they're unable to get at the moment from their biological homes. And I just want to put it out there that it's more, a lot of times, our biological parents and families, sometimes they just don't know how to support us and who we are at that time. And so circumstances will change.
Thanks, Kunane. Did Bianca or Wallace, did you want to add anything to that?
Yes, I did. I think definitely culture can play a lot in the role of some of our trans being houseless or unsheltered. And again, I'll reiterate what Kunane said. It's like queen mothers, queen fathers that go and adopt, or hanai, what we call in Hawaiian is take care of some of these youth, trans, LGBT youth that need that extra guidance, support, and navigation through life, because like Kunane said, some of our parents did not have the Google to go and look about these things. So so we call it, it's like a little ohana, you know? Yeah. So thank you for letting me share on that.
Thanks, Bianca. Wallace, did you have anything you wanted to add to that?
I do not. I mean, we would love to know so that way we can, you know, definitely get services to them and kind of figure out how we can better reach that population. So, yeah.
Great, thanks everyone. And another question that came up in the Q&A was someone's working with a trans teen and they needed support. And so they were wondering what resources are available on Hawaii Island. So I gave them my email address to connect them with Hawaii Island HIV/AIDS Foundation, but I don't know if you folks know of other people or resources for Hawaii Island.
So this is
I do know.
I
do know that they also have service sister organization on the Kona side as well.
So I'm really excited because, and well, a little bit sad. So Kiva Lekadena, who worked with us for many, many years, has moved to Hawaii Island and is working at High Half, and she's Native Hawaiian transgender woman. Yesterday was her first group for transgender individuals on the Hawaii Island. So please reach out to them, ask for Kiva. They're starting up. They also have APRN there that's doing transgender health. So there's all kinds of resources now on Hawaii Island, yes.
We love Miss Kiva. And I know for Kauai Island too, since Bianca's here, Malama Pono can provide those services, yeah?
Yes, we do HRT services here at our office and on the island of Kauai. And if anybody's needing any other type of navigation, such as filling out healthcare forms, MedQuest forms, because they want to get on HRT, we're willing to help them as well.
Awesome, thanks, Bianca. And I know the data, Wallace, that you folks shared was for Oahu point in time count. I don't know if you had any updates on our neighbor islands in terms of if they're able to, get SGM data in the future, or if that's just something that's still under discussion.
So we have not talked about it with BTG, but I would say if that is something that folks on the neighbor islands are really interested in, it would be you'd have to contact Bridging the Gap, which is the COC for all the neighbor islands, and to see. I know they would collect gender in terms of just asking just straight gender as male, female, transgender, and gender nonconforming, just because those are HUD required questions in terms of reporting, but they wouldn't, I don't believe that they ask the set of questions that we do in terms of sex assigned at birth, then gender identity, and then we as well on Oahu ask if individuals identify as intersex, which we asked for the first time last year, and we are going to be trying to ask again this year, which is really exciting. And then we also ask about sexual orientation. But yeah, I do not believe that those are asked on the neighbor islands, so I would contact BTG if that's something that the neighbor islands are interested in pursuing.
Great, thanks, Wallace, and thanks for your great data. As one of my mentors always told me, don't get mad, get data. But I think maybe nowadays we can get mad and still get data. So thanks, Wallace. Kunane, I saw a question came in from Joshua. I'll read it out loud, and if you want to respond to it, I saw you just did too. So Joshua asked, he recalled that Hawaii Health and Harm Reduction Center had support groups that were held at the main office, and this is on Oahu. Is that still available for clients? So Kunane, do you want to answer that?
So Kuana Project, am I on there? So the Kuana Project is our transgender health social service program, and they are still doing things, but in the time of COVID, they've moved everything virtually. And what's been really neat is the last couple workshops, they would deliver the day before everything that might be needed for that workshop, and then they do it together over Zoom. To get the participation, so that everybody can participate. We've also done around being, with our elder transgender community or Napua Ilima around mental health and COVID, and really it's around that being secluded for so long. And so there's still a lot of things happening. And tomorrow is our Transgender Day of Remembrance. So on our website is the announcement about that. If you have anybody who would like to come join us, it's a day that we get to celebrate our transgender family that we have lost. And so, yeah. So please reach out to HHHRC, our website or our phone, and we can get that information. In fact, yeah.
Oh, sorry. No. I just realized we hadn't fully explained cisgender, which we've been throwing around quite a bit during this talk. And so just to clarify, if you had missed Thaddeus's beautiful presentation in the beginning about sexual orientation and gender identity and sex assigned at birth, cisgender means that your sex assigned at birth aligns with your current gender identities. So if your sex assigned at birth was female and you identify as a woman, you would be cisgender. But if your sex assigned at birth was female and your gender identity is male or gender nonconforming or any other, that would fall under the transgender umbrella. So I just kind of wanted to capture that. In case it clarified anything for anybody. So, but yes, definitely Trans Day of Remembrance. I know HDRC for Oahu, and then I believe Maui as well is holding one tomorrow. So if you can, please join.
Yes, thank you so much, Wallace, for clarifying that. And I see another question that had come in about resources from Maui. And you just mentioned, so Maui is hosting a Trans Day of Remembrance tomorrow. Of course, everything's virtual, so that will be at 4. And then Kunane's organization will be hosting theirs at 6. So you can actually attend 2 tomorrow if you'd like. And there are it is Trans Awareness Week, so there will be other events, I think, tonight as well. I think Kumuhine is going to be hosting something tonight. So feel free to reach out to me. I think that may be easiest since my email is already in the chat, and I can connect you with these resources. But in terms of Maui, on that island, there's actually 2 resources I know of. And then I'll ask my co-panelists to see if there's anything I missed. But specific for trans people, there's and LGBT people, there's the Maui AIDS Foundation. They have a nurse there who's wonderful, Brian, and great staff. And then one of our big allies, of course, is Tiare over there. But also Malama Ike Oler, the Community Health Center, does have the Transcend Health Clinic, which provides trans and gender nonconforming healthcare in a community setting. So again, reach out to me and I can connect you with the folks if you're interested Wallace, Bianca, or Kunane, do you have any other folks on Maui that you think would be appropriate for resources?
Those are my two go-to.
Yes, same as here. The best person to get a hold of if anyone has experience in any trans thing would be Tiare Sua at the MAF at Maui East location.
Yeah, I don't have anything to add in terms of Maui, but I also did want to throw out in terms of Oahu. We also have Gregory House works a lot with the LGB and T community, as well as Planned Parenthood and the Lavender Clinic. They're all really great resources along with H3RC. And then Rise and Yo, they work with youth, and they definitely know how to work with, our queer and trans youth. So those are some good resources out here as well.
Thanks, Wallace. I think that's so I think there's so many resources out there, but there's still many more that we could have. So I think it's great to highlight what's available and to know that we can continue to do more. So I know some folks have to go to the next panel, many of you, including. So thanks, Wallace, for joining us. And as we close out, I'm just going to ask my co-panelists to share one action item that they think folks can do to support our SGM Houses people. So I'm going to ask Wallace real quick if you could just say one thing before you have to go.
You can follow me to Native Hawaiian panel next if you want. But I think one of the biggest things that we can do is just understanding and inclusion. So, when individuals who are LGBT, come to you for services of just making sure that one, you're treating them with respect and you're using the right name, you're using the right pronouns, even when they're not around. And just having that be, inclusion be the center of your services, I think is really important because then it'll show for your clients. So
thank you, Wallace.
Thanks so much.
See you at the next session. Kunane, do you have any action item you want folks to hear?
I'm muted. I think mine is the same as Wallace. It's really to have inclusion and that respect and treat people as you would want to be treated. So thank you.
Thanks, Kunane. And Miss Bianca?
I do want to really reiterate what they all just said, but I do want also the number one thing for me as a trans individual is making sure people understand and listen. I think we need to listen to our community, and that's where we need to understand them. So thank you.
Thanks so much, Bianca. And I guess as a panelist, I'll add my last action item is just to know that our communities have power and not to give up our own power. So take action, whether it's helping someone in the community, listening to them, as Bianca said, honoring their stories, but also policy action. Legislative session is right around the corner, and we're going to be pushing some sexual and gender minority policies through to protect our community. So use that power, provide testimony, and just know that we can protect ourselves as well. It's 11 o'clock, so I want to thank everyone and honor everyone's time. Mahalo for joining us today, and thank you for my co-panelists. It's so good to see you. So thanks, everyone.
Aloha.
Aloha.